SASSMM has been providing services in the Midcoast area for over 35 years. We were created back in 1983, and primarily we initially started out working in eastern Cumberland, which we refer to as Brunswick, Harpswell, and the surrounding islands, as well as Sagadahoc and Lincoln counties. Then in 2011, we realigned with the public health districts and we gained 2 additional counties of Knox and Waldo. So we were a little bit slower to follow with our staffing. We were to fill the needs in those areas, but by 2017 we were able to secure our first funds to have staffing in those areas. And so we've increased our programming and our support throughout the Midcoast area now. SASSMM's mission is to support and advocate for people who have been impacted by sexual violence while working to prevent it in our communities. Our work focuses on 2 avenues, basically intervention or direct services and prevention education services. So most of our work, if we're doing the intervention services, is that one-on-one support for someone who is a victim or survivor of sexual violence or anyone who's been impacted by sexual violence at all. So that could be a loved one who is trying to support someone who is going through that process and how they can be a best supportive partner to them. We would be there to help them through that as well. Our one-to-one services are our intervention services. Primarily our 24/7 statewide helpline. So if someone calls the helpline, someone will be available to talk to day or night regarding anything that they have a question about regarding sexual violence or any kind of impact of that violence that is occurring in their life right now. So someone may have woken up from a nightmare and they just need to process that. Someone could be calling and having never told their story after 30 years, and this is the first person they're telling is the person on the hotline. I think it's important that everyone who answers the hotline calls, everyone is a trained advocate to work with those individuals, and then to be there and to support them in whatever way is beneficial to them in that moment. I think that's our most critical service because anyone can do that any time of the day from any place, as well as kind of our in-person one-to-one support services. So if someone needs to go to the hospital for a medical exam following an assault, and again, that assault could have just happened or it could have been weeks or months ago, they want to go to the hospital to make sure that their body is safe and healthy, and an advocate can be there to accompany them throughout that process. If an individual wants to seek a protection from abuse or harassment order at the court, an advocate can help them through that process as well, and being there for the day of the hearing, and ongoing kind of follow-up events that are needed. And some people like to pursue or utilize restorative justice circles, and so advocates are also available to be present for them in those situations to help support them through that time. And if someone wants to file a police report, an advocate can go with them to the police station and help them file that report. So basically an advocate is kind of like there to be an ongoing support liaising through all of these different systems that are really challenging anyway, and are particularly challenging when you're going through a traumatic event. So the other pieces of our intervention that are really exciting and that we've added in the past few years, has grown and grown, is our Midcoast Children's Advocacy Centers. And those are centers that provide wraparound support and services, really, and referrals, response services for kiddos who have expressed possible cases of sexual abuse. What's important about the centers and unique about the centers is that a child is interviewed in a trauma-informed way by someone who is trained to talk to kids, and they are having a one-on-one conversation, kind of like you and I, so in a very safe, child-friendly space. And in another room at the same time, via camera and video, a team of providers and partners is watching and observing that interview happening. So in that other room, a multidisciplinary team of providers like law enforcement, child protective workers, DA, would be there to watch the interview, make sure their questions are being addressed, and also kind of gather the information they need for their particular systems and services. The idea being that the fewer times that this child has to go and tell their story, the less traumatic it will be for them, so that they can be having this one-on-one, ideally one-time interview, but possibly more than that, but that they aren't going and retelling that story at the DA's office, at the Department of Health and Human Services. They aren't having these interviews happening in their schools or in their homes, but they're in a place that's neutral and safe for them. And the other really cool part of it is that while the child is having their interview and the team is watching it, in another space, a family advocate is meeting with the non-offending caregiver who has brought that child in that day. So grandma, uncle, mom, sister is meeting with an advocate at the same time to talk about how that abuse has impacted their family, kind of connecting that family with resources and referrals for that kiddo. And in many cases, people are disclosing their own personal histories of abuse as well. And so we're also there to support them, kind of dealing with their own personal experience as well as someone who's been impacted, their little one, and kind of going through this process together. So it's a really nice wraparound support service that we can offer. Whether or not the kiddo discloses that something happened that day, all of those supports are still in place and all those referrals and resources are still offered. So it's a huge win-win for direct services. And we have 3 of those located throughout the Midcoast. We have a CAC in our Wiscasset space. We have a CAC based in Rockland and also a CAC now in Belfast. So no one within the service area has to travel more than an hour to get to a CAC, which is huge because we know getting anywhere and doing anything, especially hard things like this, we want to limit that travel burden as much as possible and make it easy for people to tell their story and kind of move on as quickly as we can. So on the flip side of our intervention services is our prevention work, and obviously that's like, trying to get ahead of the crisis is the harder part. I think, one of our vision for SASSMM is a world where sexual violence doesn't exist, and that's a pretty tall ask. So the education piece is going to be working on that for many, many years to try and change those cultural norms that are embedded in our communities. That kind of perpetuate systems of sexual violence and allow it to occur. So our prevention efforts are helping people to navigate how to have healthy relationships and how to communicate in a way that is healthy and consent-based and informed and empowered. And again, we do that through a whole range of different scaffolded curriculum from pre-K through college. But we're also looking to try and empower our teachers and educate our teachers to provide those messages as well. So over the next couple of years, we're looking to phase out of our elementary schools, moving more into middle schools and high schools, and really change the conversation around sexual violence in our communities. The second piece of our prevention work is also outside of schools, is our community-based education and prevention programming. And that's really working with community partners and providers to have them build their skills in terms of how they can respond to sexual violence or disclosures of sexual violence or harassment that occur in their workplaces or in their business practices. So we offer sexual harassment trainings and policy reviews. We provide a series of different trainings for parents and caregivers on how to talk to your kids about boundaries and consent, how to handle disclosures if a child discloses to you, how you can be a safe person for them to talk to and what to do with that information, because it's a really complicated time. And even trained people have a hard time sometimes hearing those things and knowing what to do next. Another area that we've been focusing on is increasing our trainings around human trafficking and commercial sexual exploitation of children, which does exist throughout the Midcoast. We have had a number of cases from a variety of areas, I would say, across multiple ages. So it is a very real thing that's happening, and trainings for our communities as well as for our providers in our communities to have them more aware of how you best identify cases of human trafficking or potential human trafficking and how to respond has been an increased effort in this past year, particularly during the pandemic, where we saw some increased levels of activity and concern. Also, we have very targeted trainings for medical providers on how they can best respond and support a survivor of sexual violence when they come to them, as well as if someone is working with the elderly population, they have a very specific set of needs around how to best respond and engage them in that conversation. In terms of our elder clients, it could be talking about a situation of abuse or sexual violence that happened decades ago and that they are now processing. It can be an end-of-life processing of an abuse, and so being present for them in in that way is a very different thing than being present for someone who's perhaps an elder adult who has been assaulted in a care facility that they're actively involved in right now. So that's going to look different for both places, for both kinds of events, but there are clearly similar needs of support and advocacy that are going to surround those. The education for those systems are also really important, so like talking and trainings at housing associations and housing authorities and places like that who are engaged with housing multiple people and different residents are important for them to be aware of some of the issues that can come up between residents and how they can best support the people who are involved. Our helpline is 24 hours a day, 7 days a week, and so someone can call in the middle of the night and reach an advocate to speak to them about kind of what's going on with them in that exact moment. Typically when you call the helpline, you're going to either get a direct answer from an advocate who's going to be able to work with you right in that moment, or you'll be supported by someone from the answering service who will put you on hold for a minute while they connect you with an advocate. So it's a brief process in between, but it's all to connect you with someone who can be providing supports to you in kind of whatever fashion you need in that moment. Usually SASSMM provides about 450 to 500 direct support services in a year via our helpline services, in-person accompaniments, kind of ongoing support services. I'd say during the pandemic year, we had about a 32% decrease in contacts. And primarily, I think because, first of all, sexual violence is really hard to talk about on a normal day. On a non-pandemic day, it's hard to come forward and to seek support around that issue. And then during the pandemic, people were really just prioritizing their medical safety, their physical safety, so their housing, things like that were much more of a priority issue for them than their mental health, perhaps, even if something had just happened to them. It was an easier way for them, I think, to move that to the back burner and deal with kind of like just getting by, which everyone can appreciate has been a really hard and long year and a half. So our numbers have dipped there in terms of direct services, where we had a huge increase of services, almost 400% was in our outreach and education services, because as we were being all isolated into our own little cocoons, we shifted our work to doing one-on-one individual work and going into schools or businesses or organizations for trainings and doing those all online. So we increased, as an agency, our online presence, particularly through social media, and also doing a number of online trainings and support so we can continue to be in the community in a safe way during this really, really wonky, hard time. So that has been an exciting trend upward, I would say, despite the downtrend on the direct services. I will say the ones that we did engage with when we had hospital accompaniments during the pandemic, for people who did dare to venture into a medical facility during the pandemic, they were of a more violent level than we had seen historically, and so we are expecting trends that when people kind of emerge from the pandemic, particularly kiddos who have been home, and adults, but particularly kiddos who have been home kind of isolated in smaller family networks, housed with people who may not be particularly safe for them to be with, that we will, as they enter into those systems like schools and camps and after-school programs and sports, will start to learn or identify a little bit more of maybe what had happened last year. So I do expect to see quite an increase in the number of cases of child sexual abuse that occurred during the pandemic to come to light when kiddos go back to school, and an increased level of mandated reports, which is typically how we identify kind of our levels of need in the community. So almost half of the calls to the helpline are related to child sexual abuse, whether that's happening now or it happened 30 years ago. And so I think we're going to really see an uptick in those cases coming into the light, coming out of the pandemic. So fundraisers like the gala, or even our virtual gala, are really helpful to SASSMM in so many ways, because most of our funding, almost 90% of our funding, is federal, And that's wonderful to have that much funding, but it's also really restricted funding. So we can't do creative ideas that might, meet a community need in a certain special way. And fundraisers like this allow for that kind of development to happen programmatically and to maintain staffing and increase and develop staffing skills. So fundraisers allow us that flexibility to best serve the needs of what our local Midcoast Mainers really are looking for.